It's 3 minutes after 5 local Bangkok time, and I would like to officially welcome all the participants at this COVID-19 update webinar by the Netherlands and Thailand Chamber of Commerce. A warm welcome to all our guests, and in particular also our lineup of panelists. And we are very pleased to have today a group of 5 specialists from various sectors, organizations who are joining and who are willing to share their time and their energy and insights of the current COVID-19 through this update session. We will be zooming in on the effects of the economy. We will be looking at business continuity. Of course, we'll look into the health elements, what this pandemic is all about, but also what's the travel advisories, the travel requirements, and what KLM as the national flag carrier is currently operating between the city pairs, Amsterdam and Bangkok. We will also look into booster vaccinations and all kinds of medical insights from our Samitivej hospital partners who will be also joining this call. Let me welcome every panelist personally. So you will see the microphones and the cameras are on for our panelists. And we'll start this panel discussion with 5 panelists who will give 5 to 7 minutes of time to update you as the audience from their background and their expertise. And we'll start with our president, Mr. Hurenkamp. He's not only president of the Netherlands and Thailand Chamber, but also in the daily life, the managing partner of Mazars here. After the Rob, we will have His Excellency, Mr. Remco van Wijngaarden, the ambassador of the Netherlands to Thailand, but not only Thailand, also for Cambodia and Laos. And we're very pleased and honored to have you, Excellency. Thank you for joining us. After the ambassador, we will move to Samitivej Hospital. And Samitivej, we have Chanunya Srihawan, and she is the doctor of infectious disease specialist. So she will share also her views on what the current Omicron variant is giving us as additional headache or perhaps some light at the end of the tunnel. From that, we will move on to KLM. Thank you, Estee, from KLM, but based in KL, Malaysia, to join us this session as well. You'll be sharing an update from KLM's perspective, also with some slides. And last, but certainly not least, Ernst-Otto Smit, with decades of experience in the travel industry. He's the board member of the Netherlands and Thailand Chamber and in the daily life, the general manager of Greenwood Travel. And Ernst will share practical insights of the travel between Thailand and the Netherlands, and of course the return flight into Thailand. So I think we have a nice mix of panelists. We have a nice mix of topics to discuss. We try to keep it to the point, and we have 1 hour allocated. The audience is free to send in any questions, any remarks through the chat function. So please do that. We will be monitoring that during this webinar, and we will then, after the 5 presentations, have time to zoom into some of these questions which you raised earlier or during this webinar. So without further ado, I would like to ask Rob to start to kick off as our president this webinar update COVID-19. Rob, the digital floor is yours.
Well, thank you very much, Hans, and welcome everybody. Thanks for the opportunity to talk a little bit about the economic effects of COVID-19. If you have any questions, please put them in the chat. I will try to answer. Please don't make it too difficult. That's always a bit embarrassing if I don't know the question in a question and answer session. Let me reflect back on the last year of COVID and a bit from a global perspective, what has been done in terms of economies. And it was pretty clear both in the US and Europe, a lot of money was poured into the economy. It was called quantitative easing, and the effect that it had is that the economy started again, but they also see some side effects of the rising stock markets and rising house prices. So, and that are the kind of side effects that we have seen in Europe and US. And then it's, of course, it's in Thailand. Would that be the same effect? And what is here Thailand doing in reviving the economy? And I think it's pretty clear for everybody around us that the tourism and hotel industry is suffering tremendously. But it's not only the hotel and hospitality industry. Actually, people are less mobile and they are going less to shops. So also in terms of the retail, they have difficult times. And very practically, if you go into any kind of shopping center, which used to be very bustling before, yeah, it's kind of empty, or at least less busy, and there are less shops. Certain shopping centers are even closing down. And that is one of the bigger areas. Commerce is a big part of the Thai economy, together with manufacturing, of course, services, real estate, and agriculture. If I then start looking at manufacturing, where last year we saw there was a huge shortage of shipping capabilities, there was a shortage of microchips, semiconductors, and that situation is improving. So the export for Thailand is improving as well, to a great extent actually, and that it has become a bit of the driver of the economy at this moment, which is good because other parts are struggling. Commerce is struggling, real estate is struggling, the services, certainly the hotel and tourism industry, of course, is suffering. Agriculture is doing okay. Prices went up, harvest is okay. So there will be some better yields that they will have from their farms. The prices are a bit better. So it will all go into the right direction there. And the only concern is of course inflation, where Europe and US are facing quite high inflation. Will that be the same as in Thailand? And despite that, there is a bit of a battle of pork prices. I do believe that the inflation in Thailand will be okay, for the simple reason that the amount of money that is pumped into the economy is simply less than what is done in Europe and US. The interest rates, the official policy rates, they stay the same, and also minimum lending rates are staying the same. So in that respect, you can see that Thailand has been very careful in the stimulus to get economy going. There has been some stimulus towards individuals to help them cope with the hardship they have, because there is a lot of hardship. A lot of people lost their jobs, and yeah, they very likely they move to the places they used to live, their hometowns, and haven't returned to the place where they used to work. And that is a new problem that we start seeing now, where there is a shortage of staff in many sectors, and mainly the service and manufacturing sector. The manufacturing sector has been in the news, indicating that at least 300,000 foreign workers were needed to even fulfill the requirements of the production. And for us working in the service industry, we see it ourselves that staff is getting very mobile, people are getting very mobile, and that shortages of staff are quite normal in the different sectors. So moving forward, okay, I do believe that the manufacturing will continue to grow. The situation of the logistic situation will improve, and that will drive a further development of the economy of Thailand, certainly combined with a further opening up, which allows people to go out again to buy things, to go to shops. And yes, if the tourists are coming back and start spending, then we have all complete, and we're into a good 2020 or 2022, 23, 2022 or 2023, as I can see it. I think I've completed my time here. Clearly, if you have any questions, please don't hesitate to ask them in the chat. Thank you, Hans.
Thank you, Rob, for your updates from the private sector and a bit of the sectors you have highlighted. Let's move to the public sector. Let's move to our ambassador, Mr. Remco van Wijngaarden. If you are ready, we would like to pass the microphone to you.
Thank you, and thank you, Hans, for organizing this, and good afternoon, everybody. Very nice to be here, very interesting subject. And I remember 2 years ago when everything started, traveling more or less stopped, and then we had a few lockdown periods. We even had a period where we had up to 200,000 Dutch people stuck abroad. And but luckily these days traveling is a little bit more easy, though not as easy as before. And there are still some complications, so I will try to maybe summarize what the travel restrictions are for Dutch people traveling to the Netherlands first. Let me be very clear that Dutch people are always allowed to travel to the Netherlands. There's no travel ban for Dutch nationals to the Netherlands. And there are a few requirements, though. It's the vaccination, it's a negative test report, a PCR test 48 hours before traveling, or a quick test 24 hours before traveling. And Dutch travelers have to fill in the gezondheidsverklaring, the health declaration that you can download on the website of the Dutch government. So it's not that complicated, and we have daily flights, I think, from Bangkok to the Netherlands. So traveling to the Netherlands for Dutch nationals is not so complicated. It's a little bit more complicated for Thai nationals because in principle there is a travel ban to Schengen, but the travel ban is absolutely not a full ban. It's there are lots of exceptions, and there are also two categories of countries. There's the very high risk and high risk. And Thailand is a high-risk country, which makes it already easier than very high risk. And basically, Thai nationals can travel to the Netherlands for many reasons, almost all reasons, if I can summarize it very simply, except for leisure and holidays. So let me name a few of the exception categories. If you travel to the Netherlands, if you would like, a Thai national would like to travel to the Netherlands, is if you want to study in the Netherlands, you can apply for a visa. If you want to work in the Netherlands, you can apply for a visa. Certain family visits, for instance, in case of decease of a family member or other urgent reasons. If you want to transit through the Netherlands, that's also okay if you have a valid reason. If you have a long distance relationship with a Dutch national and you want to travel to the Netherlands, that's easy. You see, we are very nice as a government sometimes. And if there's an urgent humanitarian reason, you can travel. For business, if you want to apply for a Thai national wants to apply for a business visa, you have to submit a dossier at during your visa application, in which you the Dutch company that invites you explains why it's of vital interest that you come, and you have to explain why it's physically necessary for you to go to the Netherlands. The number of visa, we are all very much aware, has decreased tremendously over the past few years. 2 years, we had about 18,000 visa per year 2 years ago, and now we are at a few thousand per year. But more than, let me check, I think more than 90% of the, no, more than 85% of the visa applications are still granted. So do not hesitate if you think it's necessary for you as a Thai national to travel to the Netherlands. Except for holidays, things are very much possible. So that is from Thailand to the Netherlands for Dutch and for Thai nationals. The other way around, I can say a few things about the travel advice maybe. in the past, travel advices from the Dutch government only mentioned security risks, and Thailand was a country with a low security risk. So we did not advise against traveling to Thailand. Obviously, we had many tourists here and many business people traveling to Thailand. But the travel advice to Thailand now is orange, which means that we advise against non-essential travel. So basically, we advise against holidays. But if you travel from the Netherlands to Thailand for business reasons, that's normally a valid reason. So the travel advice would not advise against that. There's some issues when you have orange travel advice, which relates to insurance. And some insurance company cover less when a country is still labeled orange. But in general, all essential health coverage is there. So if you have to go to hospital for something urgent, your insurance company will cover it. Though you have to always check with your insurance company what they cover and do not cover. For instance, many insurance companies do not cover non-urgent care and do not cover quarantine, for instance, or do not cover preventive quarantine if you do not have any symptoms. So you have to check that for yourself. As for the test and go policy, that's not a Dutch government policy, so I would be hesitant to explain or to elaborate much on that. But we know it's been effective now since the 1st of February. And I understand, Hans, that you have somebody else that can say a little bit more about that. And just for some background, we are also working on constantly monitoring the travel advice. And we hope in the future to no longer have travel advices based on the COVID situation, which is now partly the basis of a travel advice. So if COVID is taken out of the travel advice, we expect the travel advice to change into a green or a yellow country, which means that we will no longer advise against traveling. Will that do, Hans?
Thank you very much, Ambassador. For now, this will do splendidly. Thank you. Indeed, we will come back to travel advisory and also the test and go by Ernst-Otto Smit, who is faced on a daily basis, I assume, with this current Thai regulation of traveling from the Netherlands into Thailand, indeed. So thank you very much for this update. I would like to move to Dr. Chanunya from the Samitivej Hospital. You have been so kind to prepare a few slides, and also for you, the digital floor is yours. Thank you very much.
Thank you so much. And good afternoon, everyone. I'm so happy to be here to share about the update about the COVID-19, especially the Omicron strain. Okay, I'm just going to share my slide. Okay. All right. Good. So, okay, so start with the symptom and severities, okay, for the COVID-19. Actually, the symptoms are quite similar to other variants. So if you just look from the symptom by itself, you cannot say whether do I have Delta or Omicron. We could not really say from the symptom itself. Generally, it's quite less severe than prior variants, and but we still do have some severe case. Especially for elderly or with multiple comorbidities, and especially unvaccinated, that we still have the death case, even though we think that the Omicron variant might be less in terms of severities. One thing that we do know for sure is that the Omicron variant is spread very easily. As you can see, that is now overwhelmed all over the world, overwhelmed the Delta strains. And because the mutation of the Omicron strain is escaped the spike immunity which we do have from the vaccine or previous infection. So that's why the people who already been vaccinated or even got the booster dose, they're still able to catch to get the Omicron strain. Now for the test, someone might concern that, okay, if I have Omicron strain, will it be test positive if I do have it? So don't worry about that thing. So with the both antigen tests and the RT-PCR still able to detect Omicron as other variants. So don't worry about that part. But still keep in mind that as we know from before that the antigen test kits, the sensitivity and specificity is still less than the RT-PCR. So let's say that if you do have symptoms and you test by yourself doing the rapid ATK and it's negative, better to go to the hospital to get the RT-PCR for confirmation, because I do have many patients who did the ATK by themselves and negative, but then when they come to test in the hospital, it's positive. Okay. In terms of treatment for the COVID-19, as I show in this slide, there are more options of treatment right now. For the antiviral, we do have both in terms of oral form, injection form, or in US, they use a lot of like a neutralizing antibody, both for the prophylaxis and for the treatment. And we also, in case of the people who has very bad or severe COVID-19 infection, we use the other adjuncts like steroids or in some immune inhibitors, try to reduce the severity, the illness. The one that I put in the black color is the option that we have available in Thailand. So the mainstay of treatment right now in Thailand, there are favipiravir, which I do believe that maybe not available in US or in some countries in Europe. And the remdesivir, this is the injection that we use for the pneumonia, for people who has pneumonia. And also we have the neutralizing antibodies that the two of them that available is Wijngaarden and the sotrovimab or Sevedy, but the cost is very quite expensive for each dose, and it might not be available in every hospital. So what will you do if you've been tested positive or got COVID-19? So it quite depends on your severity. So we have the option that now, I think people for the past 2 years, people learn more about the COVID-19 and learn how to take care of themselves. So home isolation now is also possible for the people who had COVID-19, who have very just mild symptoms, no symptoms, and able to isolate themselves at home. Second option that we have is the designated hotel, or in Thailand we call like hospital. So it's like combined between hospital and hotel. So the designated hotel is basically the hotel that for people who got COVID-19. We also have the doctor and nurse available at the hotel, but maybe not need like a frequent care or more urgent care like in the hospital. Also, some people who had just mild symptoms able to take care of themselves also needs a place to be isolated. So the hospital also an option, and of course the hospital now is still available. As of now in Thailand, the current guideline from Department of Disease Control in Thailand still recommend people to be isolated for 10 days from onset of symptoms. So let's say that for people who've been infected, so we start counting from the date that you start having symptoms as day 1, and then count for 10 days that you have to be isolated from other people. So we're gonna say that you're not contagious anymore is the 2 criteria. One is that the symptoms that you used to have is getting better or resolved. And second is that you isolate yourself for 10 days from your symptom onset. After that, the doctor can write, evaluate again and then write medical certificate to say that you're not contagious anymore. You can resume your work activities or travel as your normal without limitation. For the people who are severely ill or immunocompromised, we concerned that they could be like prolonged shedding of the virus. So in that case, we recommend to isolate for at least 3 weeks or 21 days. So now, about what will you do if you're exposed to the people who got COVID? Sorry, this is in Thai. I could not really find the slide to be in English, but basically right now, for let's say that if your household member got infected with COVID, So if you have like high risk exposure, right now we recommend for the home quarantine for 7 days. And then after that, you do the antigen test or you do PCR test around day 5 after exposure. If it's negative, then and then 7 days that you in home quarantine. After that, you can go out, but you observe yourself for 3 more days. So technically, kind of like observe yourself for 10 days to make sure that after your last contact with the person who had COVID-19 and you yourself not develop any symptoms. And we recommend you to do the antigen test or the PCR test at day 5 and day 10 after exposure. And after that, if both test negative, you remain no symptoms, then you're good. You're unlikely to be, infected with COVID-19. Okay, and then I heard that someone will talk about the test and go, so I will skip this slide. So another thing that many patients concern about the long COVID or post-COVID-19 condition. So basically what I do see is that for people who had very severe illness at that time tends to have more long COVID or more complications. So the long COVID basically is sometimes could be very non-specific symptoms. Let's say that you can be feeling like feverish or fatigue, tiredness, loss of energy, loss of appetite, joint pain, joint aching, hair loss that could be ongoing for months. But then in terms of treatment, we treat kind of like symptomatically, and we make sure that it's not other illness or other disease that may be mimic the long COVID symptoms. Second thing that we concern more is the multi-system inflammatory syndrome. Luckily that we don't see that often, but it's like after you already recover from the COVID virus, now it's like your body produce immune system try to fight against the virus, but then it just attack your own cells. So some people can have kind of like the second wave of like fever and all inflammation back again, and it can occur in any organs in your body. And then the last thing that we do see is that some people can have sequelae after critical illness, both physical. So let's say that people that very severe respiratory distress, and then sometime when they recover, they might not be able to recover back to normal, or the lungs turn to have like a scar or fibrosis that might be not function back as normal. Or some people who have very bad illness, they can have like a post-traumatic stress disorder after that as well. Okay, in terms of the booster for the COVID-19 vaccine, so I get this slide from US. Okay, so basically if you got like Pfizer or Moderna 2 doses, initially we recommend to get the booster about 6 months later after the second dose. For people who immunocompromised, who on chronic steroid or on chemotherapy, those kind of things, we recommend you to get, instead of 2, you get 3 doses of the vaccine, either Pfizer, Moderna. So let's say that you got the 3rd dose about like 1 month later. And then this is not count as a booster, this is count as the primary series of the vaccine. Then after that, after around 6 months later, you get the booster. And now we accept for kind of like the mixing. So basically you get Pfizer before you can switch to Moderna, vice versa. For US that have like Johnson & Johnson, they recommend to get the 2nd dose for booster 2 months after the first one. And now we recommend more for the pediatrics, for the Pfizer vaccine, right? So should get 2 doses. The 2nd dose around 3 weeks after the 1st dose. However, with the Omicron variants that we think that is escaped the previous immunities, so many countries decide to get the booster dose earlier. So because the best we can do right now is that try to keep your antibody level to be the highest that we can. So many countries, including in Thailand too, we recommend to reduce the duration of booster dose from 6 to 3 months. This is for the first booster. In terms of the second, so let's say for people who already got like 3 doses already and asking for the 4th dose, to be honest, we don't really have the data right now. When should you get? But in theory, we also think that maybe after 3 to 6 months after the third dose, that's what we think that maybe you should need a booster. However, I heard that many countries would start to develop the new version of the vaccine that maybe try to target from the Omicron or new variants that we're gonna have. So we hope that if we have that thing, so that might be more target to the new variants. So now in terms of the booster vaccine, the mRNA vaccine is still the main booster vaccine. What about if you already get the booster vaccine already and you got COVID? So after you got COVID, you kind of got natural booster automatically. So it's like you get another dose of vaccine. Think it easily like that. Okay. So as I mentioned, we not really have data how long you should wait after the infection, but in general, we know that the antibody declining over time. So we recommend to get the booster dose 3 months after. And then what about the antibody level? Is this going to be useful? Should we check the COVID antibody level to see like where am I, where is what the level that I should be? Right now, we not really have the data or the threshold level to say that, okay, if you're above this range, you don't need the vaccine. If you're below this range, you should get the vaccine. We don't really have that data or that information. So in general, we do not recommend that you need the antibody test. So right now, there are only 2 purposes if you're gonna check the COVID antibody. One is for the research, and second is just for your own personal information. So someone is just kind of like doing experiment for themselves. After they got the vaccine, 1 month later, they check the antibody, just curious to see how things go. But whether that level, is it interpreted to be the like a protect yourself, or we don't really know. So in general, we do not recommend that you have to check the antibody level. So that will be all for me today. So thank you so much.
Thank you much, Doctor. Very nice. Thank you for this update and your insights and also your recommendations. We'll move on to Estee. She's based in Kuala Lumpur. And yes, you can okay. Estee is the KLM country sales manager, Thailand, Malaysia, and Brunei. And also Estee has prepared some slides for today's webinar. Welcome in this webinar, KLM, and Estee in particular. Nice to see you again, all the way from KL. I hope to also welcome you soon in Bangkok. But also your floor is here.
Thank you very much, Hans, for the invite. And indeed, the last time when I remember when I did my presentation, I was mentioning that, oh, I'm going to visit Thailand for sure during the next event. But look at us now. I'm still here and you're there. But better luck the next time. And I also see the new ambassador. Unfortunately, not in person, and I'm really looking forward to have the opportunity to meet everyone personally once the borders are really open fully. Yeah? So let me start today with some travel updates. I share some slides just to give an idea of what KLM is planning as well in Thailand. So Hillary, could you just move to the one slide? The network for Southeast Asia. I'm very happy. The message that I want to bring here is that we still have our daily direct flights between Bangkok and Amsterdam. To me, that is the most important because we maintain our connectivity. We have seen frequencies being reduced, the operations reduced for quite a number of other stations. But Bangkok, I'm happy to know, we are still very much present every day. So travelers between Thailand and the Netherlands and beyond is really fantastic. Huh? You have a schedule that is widely flexible, and you can be assured that it is seamless with daily operations. I know that last year we talked about Phuket, but as the way things progressed, in a way it couldn't work out because then there were more issues that came in. There were a lot of restrictions, and on hindsight, it was a good move that we did not proceed with it. So for the time being, Phuket is off the table. but Bangkok is still very much a daily flight. So that is something that I'm really proud about. Okay, going on to the next slide. This is the latest schedule, but as it is now with the current situation, there are always changes being made to review the schedules and to make changes as and when it is needed. So my suggestion, as always, is for the latest schedule, it's always on our website, which is working for all of us 24/7. So we do have a dedicated website with all the information about our flights, how to make a booking, and even information about travel. So it's either our website, or we also have a dedicated call center, which is open daily, even on public holidays. Yes, but there is a certain time to it. It's 8:30 in the morning until 5 p.m. And of course, your travel agent. Otherwise, it's the website, which is working for you 24/7. And the next slide, we talked about earlier on. I think there will be also talk about preparations for test and go, what are the entry requirements. And for that, I will not talk so much about this. Once after all the presentation, if there is any other questions, we can go back to it. But I'm glad to note that there have been changes because there were many different procedures in place. But today we have the test and go entry, which simplifies things a little bit. It's not like before where you had to go for the AQ or ASQ. And for that, we'll probably get more information from the other presenter, and as well as my colleague who can answer more details to any queries that come in. This is the required document list for non-Thai nationals. Again, like I mentioned, it might change because as and when rules get updated or there's any amendment, whatever information will be updated on our website, as well as the documents whenever we have any presentation. So for the time being, these conditions are what is currently valid. We also have on our website, there's also a very simple way of checking the travel requirements, because on our website, you have an app or a facility, a tool, whereby we call it the travel doc, and whatever destination that anyone wants to go to, it is available online, so that before you plan your trip, or it's always prudent to double check, because as you know, even myself and even our office, sometimes it's very difficult to know what the new requirements are. So as and when the information is updated, our station managers will be responsible to give all the necessary input to our head office. And from there, all the information is quickly downloaded into our system, and it's very easy to obtain. With a click of a button, you can just go in and you're able as a traveler to know, let's say if I want to go to Bogota in Colombia, what are the requirements? So it's now at the tip of your fingertip. If you don't want to call your travel agent, or you don't want to call the call center, it's really all the information is available on the website. Something that I don't think I would like to not share is something we are very proud of, because we've been accredited with the Apex World Class Award 2022. It's how would I say, it's a gold standard. It's a very exclusive validation of an airline when it comes to providing excellent care to our customers. So we are very proud that we have been awarded the Apex World Class Award for 2022. And this is something that I think when travelers choose KLM, they know that they are really going to be able to travel with an airline that has proven itself by winning such an award. Travel with confidence is something that it has been from the start of the pandemic. We've always taken all the necessary health and safety measures on board, not just in the aircraft, but also at the airport, so that when we have travelers, they can know that safety, of course, is a priority, the health part as well, so that whenever you have anyone traveling with us, you have peace of mind that we are really taking care of all the touch points that a customer would give priority to. A book with confidence is something that we are very happy to offer our customers. It's a tool which is very, or rather it's a facility whereby when you make your ticket reservation or you buy a ticket, you are going to be offered very maximum flexibility. That means if you change your mind or if you need to make changes for, for whatever reason, sometimes plans during traveling during these uncertain times, you might need to make a change. So as long as you purchase now under this book with confidence policy, you can be assured that you're given flexible conditions in making changes, even refunds. So just check on the website, we have all the information, or even the call centers and the travel agencies. Travel vouchers is something that before some customers decided they don't want to travel, and instead of asking for a refund, they opted for travel vouchers, which carries additional value. That can also be used towards purchasing a new ticket or even extra options like additional ancillary requirements like extra comfort seat, baggage. Travel Safely Together, as mentioned, we have been awarded the Apex World Class Award, and this is something that we are very proud of. And so when our customers fly, I believe today, in today's modern world, especially with the lessons of COVID, it is not so much a price factor anymore. I believe every customer value traveling safely. That means hygiene, making sure that when they travel, they can travel with confidence and they feel safe. To us, that's most important. Last but not least, something different. We talk about reforestation and sustainable aviation fuel. This is something that we are going very much into for the new year, the new world, because sustainable aviation fuel is a program that we want to share with our customers and our passengers, because it reduces the CO2 emissions by at least 75%. Compared to conventional fossil fuel. So this is a program, and this is a subject that we will come back to whenever we have opportunity to do so, Hans, in the NTCC. Also, we have another program which is called reforestation, whereby customers and partners can compensate part of your flight impact on the environment. So this is something that I just wanted to share on this slide. So thank you very much for your kind attention and for listening to my few slides.
Thank you very much, Estee. Very enlightening as well. We'll be moving on to our last speaker, Mr. Ernst-Otto Smit. Also a few minutes for you. To the audience, if you have any questions, please send them by chat. We will come back to the questions after Ernst-Otto's part of this presentation. Ernst-Otto.
Okay, no slides for me. Traveling is happening again, not in the big numbers we saw before, but the skies are open. You can fly with KLM, preferred airline, especially for the Dutch people. There are still restrictions, and also what the ambassador said, travel insurances have a limited coverage. So that is an issue, because I just jump immediately to the main point. 1 in 10 tourists now, they have COVID. Before they start traveling, they test positive, or when they come here because of Omicron. So to have a proper insurance is a must. I cannot make it compulsory, but it is a must to have, because you have to go into alternative quarantine if you have no other provisions to stay here in Thailand if you come as a tourist, and that is expensive. That said, the rest is quite easy. Okay, you need your Thailand pass. You need to stay the first day in the first few hours actually in quarantine. So the procedure is like this. People fly in. If they fly in at Phuket, they get tested at the airport. A driver brings them to the hotel. They check in. They have to stay in the hotel until they test negative. If they test negative, restrictions are over. But since the 1st of February, we have test and go 2.0. And that means there is an extra day. Also on day 5, the same procedure. You have to check into a hotel, do a test. The hotel brings you then to an associated hospital. You do the test, you come back, you have to stay in the room until you test negative. If you test positive, it's an issue. So as normally people work with all the booking.coms and the airlines were free to travel, now it is better to book with an agent, just to have backup. If things go wrong, you don't want to clear all that mess. So we do that. My expectations are that in March, the second day will go, because I think everybody see what's happening with Omicron. People get it, but it's not so severe as the previous variants. So then we will go to test and go 1.0, so only upon arrival. And I think that can stay, I'm not the Prime Minister, but that can stay until April, until things fizzle out and governments know what to act, because that is, everybody is looking to everybody and nobody knows exactly what to do. So I think in April things will get better, and I also hope that Holland will change the color of Thailand for the travel advisory, because I don't really think we should be orange like my background here. But that is another discussion. So people have hope, really have hope. We get requests, we get bookings. Most of it is all kinds of last minute bookings, because nobody knows what the future will bring if there is a new variant coming. So people plan their holidays weeks, a month in advance. They have plans, but that is what's happening in the market. But it's good. It gives hope, and people start to book. So, but in this case, we really have to work together to make policies as clear as possible. And I know it is difficult, but we as forum here, but also governments, they have to give clear guidelines. So short, things are moving forward. Thank you, Anne.
Thank you, Ernst-Otto, for this update. Again, if there are any questions, please feel free to use the chat. I have prepared a few questions. Also, we received a few by email prior to this webinar. I'll stay with you, Ernst-Otto. You mentioned it already, things are moving. Yes, you get requests for travelers, but can you identify what is actually the main reason for travelers to hold back, to commit themselves to a travel into Thailand? Is it, for example, indeed the color of travel advisory, the government advising us not to travel into Thailand? Is it mostly the higher costs related to the additional tests and the SHA hotel environment? Is it that rule of that first and fifth day in quarantine awaiting the results, or is it the insurance? What is, from your feeling, holding consumers back into currently traveling or making their bookings to Thailand?
Hans, you already gave the answer actually, because you mentioned so many things before you can travel, or what you have to do during travel. We have to guide people all the time. So if I tell people, okay, your Thailand pass, you have to do like this, you have to do your e-visa online like that, it makes people very hesitant. And also, if I tell the truth, 1 in 10, you know, they're going to get infected before or just when they arrive here. So that stops tourism massively. So they give it out. So tourism won't come back until restrictions are eased. But people still travel. People still travel. If you can take care of their needs, people will travel. So at this time, actually, just back to the 90s, when we started, 1990, it was the same. People needed help they needed a travel agent, a tour operator to travel. And then everything was made easy, and it is now just back. But it will come back. It all will come back. The travel will be easy. Tourism will come, and I really would like to work to make tourism more sustainable than it is now. But that is another discussion.
Thank you indeed for zooming in on that, Ernst-Otto. You mentioned the color travel advisory, and moving on to the ambassador. Currently, Thailand, as the ambassador mentioned, is a high-risk country, and because of that color classification, it will have an effect on indeed the Thai nationalities who would like to travel into the Netherlands or the EU in particular. Just to elaborate a little bit on your remark, Ambassador, the remark about Thai nationalities wanting to travel for leisure reasons, you mentioned that is currently restricted. Holidays, no new visas will be granted. Is it also the case for, let's say, family members? Most of our audience probably are married or have partners, Thai partners. They would like to visit their family in the Netherlands. So how restricted is it for a typical, let's say, Dutch gentleman with his Thai wife traveling in April to see the opening of a Floriade, and the restrictions currently based on the colors of the Dutch government?
Travel in the framework of a family traveling to the Netherlands is one of the exceptions. So if the Thai national travels to the Netherlands with a Dutch family member, then that's a reason. That's one of the categories that will allow for a visa, if everything else is obviously according to the requirements also.
That's very clear. Thank you for elaborating that. Then the color coding itself, I know there's frequent dialogue amongst the EU member states, I believe every 2 weeks. Is there any expectation now that we see a lot of EU countries opening up their borders? Is there any expectation that indeed the color behind us will be a lighter, let's say a yellow version? I know you also don't have a crystal ball, but please help us guide through, let's say, that process.
And do you mean the color of the travel advice?
Yeah, so the color of the current advice of the Dutch government, where let's say Thailand is orange, while other long-haul destinations like Curacao is yellow, or that kind of thing.
Yes, I know that currently the travel advisors also take the COVID situation into the color code. And whereas in the past that was not the case, and the Dutch government, like many governments, tries to prevent holiday traveling because of the risk of contamination when people come back to the Netherlands, etc. But the situation is changing, as we know, and I am not somebody who can look into the future, but I know that in many countries, including in the Netherlands, there are discussions taking place, and we're close to a decision where we might take the corona element out of the travel advice. And that could mean that we will leave it up to Thailand to decide if tourists are welcome. That's, basically Thailand, is up to Thailand to decide if Dutch people are welcome. But then we will also take that advice out of our travel advice in the future. I cannot guarantee it will happen, but there's a lot of discussions that it should, and if it will happen, it will mean that Thailand will probably go back to the color code as it used to be before Corona. But again, I cannot predict.
Okay, thank you. We won't hold you on that. Don't worry about that. Final question for you, Ambassador. There is an update. We understand that the EU has also, how can I say, identified the More Prom app, which we all have here in Thailand, for easy traveling in the EU. Is that correct? That we, with Thai More Prom, do not have to go to any physical office in Utrecht or somewhere else for our, let's say, traveling within the Netherlands and the EU? That's
correct. So the Thai pass or the Thai QR code is accepted as a valid QR code. So we'll give Thai nationals with that QR code the same rights as a Dutch person or EU person with the same QR code. Before this webinar, I tried to check if there are any issues with the implementation of that decision, and I haven't been informed of any issues. So that doesn't mean there are no issues, but I'm not aware that there currently are any problems with it. So I assume things are going well, and if they are not, we will inform people and we will try to take steps to correct that.
Great. Well, thank you very much for your input as well. Moving on to Dr.
Sorry,
sorry.
Yes. Sorry to interrupt you. One more thing. For Dutch nationals that do not want to use the Thai pass in the Netherlands, or that do not have a Thai QR code yet, they still can go to those 3 locations in the Netherlands to have their vaccination certificate set into a QR code.
Thank you for that elaboration. And I'm sure there are information sites where our guests can look that up. So if anybody in the audience would like to know where to find this information, we'll share this and we'll talk with the colleagues of the embassy in sharing the right information. Thank you for that as well. Then I would like to ask the doctor, this is maybe also a similar crystal ball. We not know the future, how it will look like, but perhaps the doctor can shed your personal and your professional view on this current virus. Are we happy that an Omicron is around compared to Delta? Meaning, is this the end of the light of the tunnel? Do we see the end? Is this really a blessing in disguise? How do you evaluate the current Omicron variant?
Okay, yeah, because as you mentioned that as of now, we saw that for the Omicron strain, the people tend to have much less symptoms, and even some people like totally no symptoms at all. So many experts think that, I mean, because we know that we could not completely get rid of COVID-19, we think somehow we're gonna live with that. Okay, so some people like start to think that maybe it's gonna be kind of like a other viral infection, or it could be another kind of like an influenza or flu in the near future. So, but the problem is that because now when we still have the dead case, so I think that's the main reason that like they still not be able to change that completely to be the infection that not need to be observed. So I personally think that, as I mentioned, so if we don't really have like other new variants that attack us like hard again, maybe everything will start to go back to our normal.
Thank you very much, Doctor. We'll keep our fingers crossed and we follow the news for potentially booster 4, booster 5.
Yeah, right.
But allow me to also thank you for being a great partner in providing Moderna and other boosters for the NTCC community. Much appreciated.
Thank you. Appreciate it too.
Moving on to KLM, if Estee would like to share your views on the current, let's say, dynamics of the airline industry. Estee, I know Bangkok has always been a route which is in high demand and also a lot of competition. Currently, of course, not every airline is flying and not able to fly. Can you shed a bit of a light on the current, let's say, load factors? What are your views on the pricing mechanism? Is traveling really going to be more expensive, or is it going to be cheaper? What is the current, let's say, dynamics of this particular Amsterdam route?
Yes, travel definitely has not come back yet. If I look at the load factors, I will not give you a percentage, but all I know, all I can mention or share, it's never full. I mean, the only time when the numbers go up in the 300 was like before COVID, and the only flight is probably once this year. I saw one particular flight, it's a weekend with number of passengers at 300, and I think it will continue like this as long as the restrictions are there, as long as we have the say what you like, even though travelers are now allowed to come in, there's test and go, they have the sandbox initiative before, but the numbers were never there as long as there's restrictions in place. There's always concerns about the virus. Do I catch it, and what happens? Am I insured? And then will my holiday be a wasted trip? So unless and until this is done, then we will probably see things pretty much the same. Choppy factors, choppy load factors. But that's why for Bangkok, it's not a turnaround. We also share the aircraft with other stations. It is to make it sustainable. Otherwise, we cannot really fill up the aircraft by ourselves. Now, what it means, it will be baby steps for sure. We will see opportunities. That's why on the website, whenever you want to make a booking on the flights, we do have good fares. It depends again at the time of travel, whether it's the load is the particular cabin in the aircraft, the booking class that you're looking for. If it's full, then it goes on to the next class, because there's always opportunities for very good deals. But that is if you book early and the particular route is not fully taken up. So we do have watch and match, whereby we also benchmark against other carriers. But having said that, we believe that when passengers choose KLM, they know that this is a ticket that will give them flexibility. In case you do make a change, at least you're not tied down to having your entire ticket burned if you need to change for whatever reason. So these are all the proposition that we offer our clients. So no crystal ball here, but I believe that things will improve. In fact, once the regulations are off, we have seen it happen before. The minute Thailand announced a test and go, we've seen on the website, suddenly the bookings just shot up. So I believe the catalyst is really very much for travel requirements to be eased, and then we will see a recovery. It's not going to be immediate, but it will be a more sustainable approach towards recovery.
Great, thank you for that, and we wish you all the success in that recovery period. I know it's not an easy time for an airline, but we're very happy that, of course, we have a daily flight, and that gives us also the flexibility in case of urgent needs of traveling. So thank you for that. We are a bit over time, but I would like to ask a few more questions to Rob, knowing that he has a crystal ball and he can look into the future. And relating to, let's say, the sectors, Rob, your own sector, just to share a little bit your observations in the last couple of months and what you predict. Are we really all going to be working more from home? Will it be a hybrid model? And also in that respect, will we be traveling less because of business travel is simply out of fashion, or it's not required because we can do Zoom meetings? What is your high level take on, let's say, that mechanism?
Yeah, well, that's you saved the most difficult question for last, Hans. See, there will be changes, and clearly the 2 years of COVID have taught us quite good lessons on how we can work from home, and companies will see, certainly in the service industry, that working from home has great advantages, reducing office space, which is very cost efficient. Working from home, it works very well for staff. Many staff actually like working from home. We see now, when we slowly start returning to the offices, that many of the staff is reluctant to go to the office because it's quite convenient working from home. So what we are looking at is kind of clever models where the function of an office has changed from the place to work to the place to collaborate. And with that, you can get some kind of very fancy models and very fancy designs of offices to really make people almost feel like being at home. Very cozy environments. That will be a bit of a hype, maybe in a few short. In the longer term, I do believe offices will regain some of the functionalities as a place to work. But you see, for example, larger American banks, they really start recalling all their employees back into the offices, as it is simply easier to communicate and to collaborate. In terms of traveling, and I'm sorry for KLM, Esme, but that will be limited. We've learned to do board meetings from behind our computer. We have learned to do operational meetings from behind the computer. Where it's getting more difficult is the sales meetings. So yes, those still will happen. So it will take some time. Clearly, companies will struggle to find the right, certainly in the service industry, find the right way to between working from home, working in the office. Hybrid model is the consensus at the moment. Clearly, that will change over time. As whenever anybody is in the office, everybody's happy and it's one big party.
Well, on this positive note, Rob, I would like to say thank you and all the other participants of this panel discussion. We are a few minutes over 6 o'clock Bangkok time, so we don't want to take too much of your private time wherever you are. Allow me to say thank you to all the panelists, Ambassador, Rob, Dr. Estee, and Ernst-Otto as well. Allow me to say thank you to all the participants who joined us for today's session, which is actually recorded. So we will send the link in case you would like to look this back. If there's any other questions which you would like to be clarified, please do let us know. We are here to help and support. And we, of course, as always say, stay healthy and stay sane during these uncertain times. And we hope, of course, soon things will become to some sort of normalcy again. And until that moment, I wish you all good luck and a good health. Thank you very much on behalf of the NTCC, and hope to see you all soon live again.
Thank you very much.
You.
Bye-bye.
Bye.
Bye.